This is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran. Chapter number 25, Illustrative Cases. Case number 12, a woman age of 35 years, a teacher. She has had bad cough and menstrual period and menstrual problem. First interview was in 91. She is asked about her nature. She said, when I trust people, I am asking that they should be very honest. I don't like being betrayed. I don't like to be misunderstood. I don't like to take a revenge. But I like to make see they have done something wrong. I like to person to know when they have done something wrong. I get annoyed, irritated. I don't like hypocrisy. I like people to be straightforward. As soon as I see the person has betrayed me, I feel bad. My father died very young. I always wanted to have a father. She started to weep while narrating, and I work at two places. At one school, there is a principal, and I think of him as my father, but he is so inconsiderate. He incites me, harass me, humiliate me in front of others. He doesn't give me the respect due to the teacher. I gave him that respect and honor. I don't know how to describe the feeling. Why does he do that? I ask her, why does he do that? And she said, I don't know. She start weeping again. I only worked there for 2 hours and I am busy for those 2 hours. He accused me a lot. He listened to the other people. I don't know who is jealous of me. I work in a Calcutta and no one bad any complaint about my work. This man finds everything wrong with me. I tried to give my resignation, but he will not accept it. He does not want her to leave. She should have walked out, but she needs the situation and he needs her. I don't know why he listened to other. He insult me in front of other. My relationship is good with everybody. I have done nothing wrong to anyone. Another teacher who is not qualified, she fight with me, wants to put me down, trouble me. He takes her side, and this is injustice. I don't expect him to see me as his daughter, even though I see him as a father. He wants me to support him in everything. In the last 15 years, I have given in my resignation so many times, and he is such a liar. How can he teach morality to the children? He blames me for my character. In other place, I have no complaint about my character. Every teacher and student has a high regard for me at other place, and he keeps listening to other people. And you can't have ill feeling against someone for no reason. He is so rude to me in front of people. The teacher who isn't well qualified is in the good book of the principal. She wants favors from him. She fight with me openly. She has a high pitched voice, a quick complaint tone to it. Like my principal is very irritating. Is it irritating like your cough? Ask her, is it irritating like your cough? And she say, maybe I will not stop fighting. Why will not he let me leave when he is unhappy with me? At that time, she was playing with her finger. Then I ask myself, is this the situation she has chosen, or is the principal really a bad man? And can she really not leave this college? That was my question inside me. And then I asked, have you had any similar problem in the past? And she said, yes, it always happened to me. In Calcutta, one man used to irritate me. He used to shout, and other people warned me about him. Another woman was instrument to irritate me. When I had the proof, I throw my books on the table and I walk out. Then they asked me to come back. I wrote and asked for an assurance of honesty before I would go back. This place here is very irritating, but I don't know how to come out. Then I asked, why don't you walk out? And he says, I am teaching betrayal the student. Why should I let the student suffer? They have done nothing wrong. And I asked, what dream do you have? And she said, of being down of my father. Her father died of leukemia. And I asked, what is the cough like? And she said, I feel of feeling of something stuck in my throat. It has to be swallowed like ball in the throat. It is worse at night. I have to wake up. When I am angry, I tell the person, you have done wrong. I will just shout out and I want to the person accept his wrong. And I don't have anything against him. I just want to treat it as a human being. Then her husband is asked for his opinion, and then he said she overreact to what is front of her, and her tongue is cracked in the middle. On the follow-up of this patient, the cough improved immediately, but she was an excited as ever. She received dose every month by January 92 till today. The cough is better and attack not so frequent. I still get angry, but I try to be cool instead of retaliating. My situation at the institution is better. I don't talk. I keep quiet. She had a problem in past with the weeping, pus oozing eczema around her ankle, and the skin trouble recur quite badly. She couldn't walk for 2 weeks. The cough is now almost gone. Her nature is to react to injustice, and the sensitivity has reduced by about 30%. And after follow-up of 3 months, she had a high fever and on the advice of a colleague took some Hippersalve. I got no better, so she took some antibiotic, and she used to have a throat problem in childhood. And then I asked her, how is your nature now? And she said, I am not shouting much. Her husband says she is subdued and she still fight, but it is more polite than before. The sensitivity is still there, but the reaction is less. Her periods are now on time and lasting 5-6 days. Her skin is slowly getting better. She feels fine overall. And I asked, how are your mood? And she said, sometimes I am in a bad mood, but usually I am okay. Her husband says the situation has improved. I'm trying to understand everyone. I can't change everyone, so I have to change my attitude. I can't force everyone to behave the way I want. I try to understand them. I asked the husband how he sees her now, and he said she is more sober. She used to be tickling bomb. She sound less winning now in the voice. And what about her dream? And she said, I used to dream of a fire or being drowned. I used to dream of a saint coming before my marriage. I used to meditate every morning and night. Then I asked about the principal, and she said, I still have that. There are still problems, but I look at it differently. I had a discussion with him. I listened to him coolly, and I was not excited. I didn't want him to know my feeling. I wanted to understand him. Previously, I was looking at him more like as a father than a principal. I am keeping my distance. He is changing his attitude to me. And now, what are the features of this case? An answer is the relationship between her and the principal, whatever her perception is of this relationship is what she has created in her own outer reality. She has two feelings. He is my father, I need him, I want him, I can't live with him. But what does this mean to man do? And he betrayed the trust. She needs people to be honest. I need to trust, and the person I trust betrayed me. How can he do this to me? How can he harass or trouble me? This is her reaction, means anger. This is what she feels, and the anger is provoked very easily, even by small things. An analysis of this case is what? In the case, there is a two feeling. There is an extreme dependence on the father-like figure to extent that she could not leave the college through the so logical should have done it under the circumstance. Logically should have done it under the circumstances. The dependence is the psychotic aspect of the case, which is less striking than the other feeling, which is tremendous violence provoked by feeling of a persecution. The syphilitic feature of this case. The psychotic weakness means the dependence prevent an uncontrolled violent reaction and escape. She is continued to work under oppressive condition and feel oppressed with the desire to get out. I have resigned many times. She feels so oppressed that she say, I only want to be treated like a human being. At this time, she get violent anger and the case falls between the psychosis and syphilitic. It means it is a tubercular miasm. To select the remedy, the following specific feelings are selected like delusion deceived, delusion persecuted, delusion vexation and offenses, company desire for when alone, violent, paroxysmal harassing cough. The drug chosen was Drosera. The patient was given Drosera 1 m and gradually till Drosera 50 m, she improved not only in her cough and menstrual problem but most strikingly in the mental state. Now, I want to give one note that Drosera, the sundew, is a carnivorous plant and it is trapped insect. Incidentally, on seeing this case, my friend Misha Nolan remarked that the potency are made out of the plant with the trapped insect